Good morning, everyone. Hello and welcome to our new webinar mini-series, Tuesdays with TEF, where every first and third Tuesday, we will bring you a new bite-sized educational opportunity, and we will always end with a calming, stress-relieving exercise. Our hope is that this mini-series continues to provide education benefits remotely during this pandemic, provides a sense of community, and keeps us all connected. Whether you're joining us from your home, work, on your break, or your car, we're glad you're here. So thank you so much for taking time out of your day to tune into our webinar. First, want to go over some of the housekeeping items and familiarize yourself with this Zoom webinar tool. First, everyone will be muted to eliminate background noise until the very end of the webinar. If you'd like to make a comment, if you can't hear the speaker, need technical help, or if you just want to say hi, please use the chat feature. If you have any questions for the training fund or the panelists, please type your question in the Q&A tool. We'll either enter or answer it immediately or want to answer it live during the Q&A session later on today. Wanted to make note that we are recording this webinar and we'll add it to the library of webinar recordings and resources on our website, thetrainingfund.org, if you wanted to review it later or if you wanted to share it with others. If you are tuning in on your phone, your features may look a little bit different. You will have the chat feature toolbar maybe down at the bottom or at the top of your phone screen. And you will also have the same Q&A feature. And if you don't see either of those there, look to the 3 dots for more features. So I'd like to provide a quick overview of what you can expect from today's webinar. Agenda will include a quick icebreaker, followed by a poll question, and then we'll dive into the topic of communicating with residents during a time of crisis. Then we'll have a Q&A session for our panelists, and another quick poll to gauge your interests, to give us some information moving forward with our planning for Tuesdays with TEF. And we'll always end with a short and easy deep breathing exercise to add to your daily stress relieving routine. So I'd like to introduce our presenters for today. I'm Jenna Klaus, your moderator, and I am based out of Pittsburgh, Southwest PA. We have Melania Shaveri, a presenter who is a program specialist and instructor in the Harrisburg area. And we have Christine Berg, RN, presenter, our nursing instructor in the western part of the state. Linnell Watkins is our co-host, and she's our regional coordinator in the Philadelphia area. And Fatima Olalei, co-host, managing the chat feature. And she is our program specialist and instructor for mental health first aid in the Pittsburgh area as well. I would like to introduce Melania to open up with our icebreaker. So Melania, take it away.
Hi, everybody. Thank you for being here. Before we start our presentation, we wanted to share with you a little brain teaser to have fun and to get our minds ready for the webinar. So the question is, how many animals can you see in this image? If you have an answer, you can type it in the chat. I will give you 30 seconds. We already have some answers. Come on. Don't be shy. Take a guess. All right. Our 30 seconds are gone. We have some answers. If you have any other answers, just go for it. Okay, so as you can see in this image, the answer was 16 different animals that we can see in this image. Ain't that crazy? It is hard to spot all of them, even when we have them labeled there. But thank you so much for participating. We had a couple of people that had them right. Well, almost right, very close. But thank you for participating. One thing that we wanted to show you with this image is that sometimes it happens in our daily life that we are looking at the same image, but we all have different perspectives. So this is something important that we can keep in mind when we interact with others. So thank you so much for participating. Back to you, Jenna.
Thank you, Mayla. So I'm hoping that that gets us started in the right direction today, thinking of us all seeing the same picture and how we interpret things differently and how we approach things. So I want to get started with our first poll question of the day. We'll be asking for a couple different questions throughout the day, but I'd like to launch this first one to help us thinking in the right direction, and we'll have about 15 seconds to answer. So first poll question. Do you know of residents in your building who have developed anxiety and clear signs of distress concerning COVID-19? Yes, no, or maybe just a few. So please take the next 15 seconds to answer. Okay. All right, so it's about 50-50. You have folks that are having clear signs of stress within your residents, some just a few, but some maybe some more, a lot of folks in your buildings. So we're hoping from today's session that you will have some mechanisms and thoughts on how to approach and communicate with your residents to alleviate that anxiety and those stressors during this stressful time. So thank you for your participation in this first poll. Okay, so now I would like to introduce our next presenter for the day. Some of you may recognize her. Christine Berg is a skills enrichment instructor in the western part of the state, and some of you may have taken one of her classes in previous years. And I'd like to turn it over to Christine Berg to please carry us through this educational opportunity of communicating with residents during a crisis. Chris?
Thank you, Jenna. Good morning, everyone, and welcome to today's featured webinar topic. And our topic for the day is going to be communicating during a crisis, which we are all faced with at this present time. So we're going to be talking about communicating with residents who are alert and oriented, who have a little more understanding and can be a little more receptive to what needs to be done in time of crisis. But we're also going to be talking about the dementia resident, who, as we know, is very difficult, and they don't understand. They don't mean to be difficult, but they have a lot of fears, and they don't know how to be receptive to the rules and the changes that we have with today's crisis. So as we know, everyone is affected by the crisis. It's still a virus of unknown certainty and definitely a delicate topic for anyone affected by the fear of it. So we're going to move along and talk about it, and at the end we will have opportunity for question. So the biggest thing that we as healthcare workers need to do is keep those open lines of communication. So the first couple slides will really be talking about that resident that you can carry a conversation with and that they're going to understand. The biggest thing is never worry alone, right? Nobody wants to feel alone in any type of a situation. We always want someone who can sympathize or empathize with us. So one thing about COVID-19, it doesn't care if you're a caregiver or a resident. We are all possibly exposed. And, you know, all could possibly be affected by it. So it's an equalizer between us all, really. We don't want anyone to worry alone, so we need to be there for one another. Being there for one another, encouraging and supporting one another is just really allowing that opportunity for listening. And keep in mind, when it comes to listening, we want you to listen to hear and not listen to respond. So this is going to promote teamwork and show compassion and empathy. And that's what it's all about. We want to lessen the anxieties. Teamwork, as we know, is essential. The caregiver and the resident are both team players, as we all know, as well as all the disciplines in the healthcare setting. So again, let's keep those open lines of communication to lessen the anxiety for all of us involved. And truly, everybody's involved in the plan of care. So how do we do that? Keeping the residents informed. It's probably one of the first approaches that we need to do. We all say there's lack of communication, right? Communication's always key. So we want to keep them informed. Keeping them informed is going to allow them to be educated. They're going to feel very valued. So what do we do as healthcare workers? We're the patient advocate. Keeping in mind, stay within your own scope of practice when it comes to speaking the language and, you know, engaging in discussion with a patient over a healthcare topic. Coronavirus is a public crisis, so we all are responsible for our own knowledge as well and keeping ourselves informed. But let's start with the patient. Keep them up to date with the ever-changing knowledge, and we know it's been changing very rapidly, about the virus. And again, this is for yourself and for your patients. Recognize that the virus continues to present with new knowledge, and it could be frustrating for the residents, having the restriction of visitors, things like that, and it could be frustrating for you as well. So the future of the virus is unknown at this point in time. So it's really up to you as the healthcare worker to promote safety and security for your resident. And right now you are their security because you're their lifeline. So keeping them informed, again, about the standard of care, that the interventions that your own facility is doing to protect and safeguard their well-being. They may not be aware of, you know, all the interventions that your facility has put into place. So again, the residents that are alert and oriented, make sure you're informing them when opportunity presents itself. And this is a simple discussion that you can have whenever you're in there just doing your daily ADLs. So keeping them informed is the biggest thing, really, and that's what we have here at the top of this slide. We talked about educating, having a plan and communicate regularly. So it's very important, again, not only that you keep them informed, but you keep yourself informed as well. Something quickly about keeping them informed is if they have technological devices, that we can keep them engaged with their family members at this time. Something you can do, again, as that advocate, is to keep them connected to their families and their loved ones. You may have residents who already feel neglected just because they're in the nursing home. And you also may have residents who don't know how to work some of these, you know, devices that they have. But if they have capability for social media, things like that, this is when we take that extra time to, you know, get on that social media, dial that number for them, make sure their phones or iPads, whatever they have, are charged. Just remember, social distancing does not have to mean social isolation. PPE, I want to mention, has become a barrier between you and the resident. It interrupts the human connection and the human touch that everyone desires. You are the main source of human interaction for your resident during this time, especially with the restriction of visitors. So stay engaged, keep those open lines of communication, because again, you are the lifeline at this time. So acknowledging feelings, and as you can see here, if you're able to see pretty good on the device that you're on, they're holding hands. So it's a hands over, hands under approach. And that's something that we can talk about later. But it's just a simple little approach to let them feel valued, feel wanted, feel loved, you know, feel a sense of self-purpose. So it's important here that we internalize and recognize our own feelings. When I say our own, you know, myself including as a healthcare worker, you want to recognize your own feelings are surrounding the coronavirus and regarding all the changes that have, you know, been abruptly enacted. And also you want to try and learn the residents' perspective of it, and you want to respect their feelings even if they differ from yours. Keep in mind, coping skills are going to be different in an individual. They're very unique to every person, and personal experiences are going to be the influencing factor for that. So remember, everybody copes in a different manner. Those personal experiences, personal life experiences are really that influencing factors. That's going to engage in how one manages their own coping skills. So listen carefully, as I said earlier. Listen to hear, please do not listen to respond. Listening to hear will allow the resident to express their own feelings. It'll give you some clarification, it'll give them clarification. Again, we don't always have to understand one another's feelings because sometimes that's very difficult to even try to do that. It's hard to empathize if you haven't really been in somebody's position before, but acknowledge that it's very important to that individual, just as your feelings are as important to you. Stay very grounded and focused on your own facility resources, and remind the residents and that all that's involved, everybody is at risk in regards to the coronavirus. So the importance of keeping them educated about infection prevention to prevent the spread of the coronavirus is imperative, and it also will prevent other communicable diseases. So those were just basic approaches, but something to reiterate on things that we have to keep in mind when it comes to communicating with our residents. And I'm sure there's been challenges out there because it is a very delicate topic. So, and I say that because everybody's been affected. Some people may have lost coworkers, loved ones, and things like that. So it's real and it's a frightening time. But moving forward, let's talk about how do we engage in conversation with that resident that has dementia. They're not going to understand anything about COVID-19, but let's talk briefly about a baseline of what dementia is. It's not a specific disease, okay? Some get confused a little bit, but it's a group of symptoms, symptoms that create brain change, memory loss, and eventually it leads to physical loss. So Alzheimer's would be a type of a dementia, as well as Parkinson's. Dementia is progressive. It has different stages. In those different stages, we have different cognitive changes that's going to create different skill changes in the body, physical changes. So living with dementia, as we know, is challenging for both the caregiver and the resident. And that is on a daily basis, right? So communication is difficult because their level of understanding is not the same as ours. So how we approach them is going to be very unique. Consideration of individual cognitive ability and level of memory loss is really key here. The environment that they know is normal has now become very different. Some residents may not understand social distancing and may exhibit their stress through behavior changes. It really needs to be a collaboration of all facility disciplines and the ancillary staff to participate in this unique approach for individual caregiving. So really, it is all disciplines within your facility, not saying it's just direct care workers, all disciplines of the healthcare setting. So again, dementia residents are a challenge. They're a safety risk. How can we keep them isolated in their room during a time of social distancing? These people need to be engaged. These people, we don't want them to be isolated. They're not safe to be alone. Some are fall risk, some are wanderers. So these, again, are things that we have to keep in mind. So this coronavirus has become an added obstacle for all of us, right? Next. Sorry about that little pause there. My computer wanted to reboot at this time. I had to tell it no. Okay, so moving forward, we're going to talk about a unique approach in how we deal with these types of residents. So consideration for dementia during COVID, we're going to use something called GEMS. It's a brain model approach. I myself have recently learned of this approach, so I can't say that I've known about this for a long, long time, but I love the uniqueness to this and really the focus behind it. And the focus behind it is not to focus on what the dementia resident lost, but focus on what remains. So a woman by the name of Teepa Snow, she's a national dementia educator. She's the one who has developed this brain model approach, and I'm going to just give you the basics about it. But listen carefully because it is definitely very interesting. So this brain model approach is a model that dissects the different stages of dementia and the progression of it, and different approaches for us as healthcare workers on how we approach our residents who may be in those different phases during resident care. So early stages of dementia, as we know, could be very mild, and this type of resident may understand what social isolation is, and they may be receptive to it, and they may understand the importance of infection control practice. But a resident in a different stage may not understand. So that may be why staff look vastly different as they walk through the hallways wearing their PPE. So this may cause fear for the resident who's not really able to understand. As we know, with fear becomes behavioral changes. So the brain model approach is going to help us understand the skills that we need for communicating and caring for residents who are going through these different stages. So the 6-foot social distancing, as we know, is hardly reasonable and achievable in the dementia resident. But we have to try and maintain that, right? So something just to remember, elderly residents are already prone to feeling neglected. So really at this time of need, especially with our dementia residents, we have to still help maintain social distancing to prevent infection. However, we've still got to find a way to somehow stay engaged with them for their safety. So self-isolation, something to think about, can lead to an epidemic of loneliness. And really this could be for all walks of life here. People are people first. People with dementia are second. The life of a dementia resident should be filled with purpose, right? For them, it's about human connection. Okay, so this, I don't know what type of a device you are viewing this from, but if you can't see real well, it's okay. At the end of the webinar, on one of my last slides, I do have a reference page, and there are links to this if you'd want to print it off. And you'll also get an email. The Training Education Fund will email you since you've registered, and you'll get all the slides to the webinar. So if it's something you want to look at afterwards, it's a great tool. It really is. So on this slide, it's going to show the GEMS progression of dementia. I don't expect you to memorize this. This isn't something you have to memorize. It's just something really to be aware of. To acknowledge the different changes and the different stages with our dementia residents. So it's good for you to consider your own approach, again, in how you're caring for this type of a patient. So the very first stage really is the normal stage. It's normal aging process. We are all going to get to the sapphire stage, whether we ever individually get a diagnosis of dementia or not, we all get to the sapphire stage. The sapphire stage is our first stage. That is the normal aging process. Just want to make that clear, because you may, as a caregiver, be in that sapphire stage, which is very unique. Doesn't mean you're going to have a diagnosis of dementia, but it's just to recognize there is a normal aging process, right? And we all will go through it. So sapphires is the first stage. We call these the true blues. A resident as a sapphire is going to be one that still comprehends, but just maybe a little bit slower. Again, that normal aging process, they can still do little tasks. They're just slower. They may feel a little bit blue because they're aging. Okay, some people have a hard time accepting aging, but that's our sapphire stage. Our second stage is called diamonds, and here's where we really get into the cognitive changes. Diamonds, remember, these are all dementia residents and phases. Diamonds, these are residents that are into their old habits and their old routines. They do not do well with change. Nobody likes change, right? But they don't do well with change. So they like to tell the same stories. They like to ask the same questions. How do we, engage in conversation with these people? But we find a way, because they want to feel like they're completely valued, and they like to do things that give them a sense of self-control and self-purpose, and they're only human. Everybody really is that way. So the third phase is the emerald phase. And if you think of the gem of an emerald, it is green. Think of green as go, if you think of a stoplight. So GEMS The emerald, the gem is the emerald, I'm sorry. The emerald we're talking about is, or the gem we're talking about is emerald. These people get lost in past life. They get lost in past places, past roles. They're on the go. These residents want to be on the go. So again, think of that green emerald as go. They don't realize that they even need help in this phase. They need familiar tasks, but these are your busybodies. They lose things, then they blame people. They think people stole them. They get a little bit of a paranoia here. These are the residents that need to stay engaged. Amber is our fourth stage. This stage, residents can only be in the moment, right here, right now, not a minute ago, not a minute later. They're in the now. They have no safety awareness. They don't understand sense of time. They're not going to understand why you were wearing your PPE throughout the entire day. They may even think the PPE is interesting if they find it in a garbage. Oh, what's this? Let me pick it up. Let me feel I have to touch it. These residents have a sensory need. They want to touch, look, feel, and taste everything. And I'm sure you understand these types of residents because you work with them. These residents may also resist care. Something, just to give you a little example, as a dementia resident during this time of crisis, if we change routine on them, dementia residents who maybe once ate in the dining room, who now have to eat in their room. So because they've had a change in routine, it throws them completely off. We know that already with the elderly, right? You take them out of their normal environment, it could cause a sense of delirium, like acute confusion. So imagine that with a dementia resident. So let's add, two problems, I should say there. So change in routine is not good for them. The type of resident that always ate in the dining room that now has to eat in their room, they may now forget that they even ate today because it was completely changed. So it is a challenge. It's a challenge to get the dementia resident to understand what a role is when they don't even understand what a role itself is. They don't have that concept anymore. So to keep a mask on these people, nearly impossible, right? Moving on to our Ruby stage. It's our fifth stage here. Ruby is our stage where the residents start to lose their fine motor skills, okay? They lose hand skills, they lose eye skills, they start to need support. These are the residents that want to walk down the halls holding onto the rails. They want to have a walking routine path that maybe they walk every day. They're starting to not be able to speak and or chew well. They become definitely a risk for aspiration. We need careful consideration at meal times. They need constant cueing. So, how do we engage in conversation with these people that can't really talk? Music. Music will bring them alive. It'll bring them to a time that they're familiar with. They may not be able to voice something about that music, but guess what? They're going to feel alive inside. So with these people, I would say communicate through music. If it's the TV in their room, they have a little radio, songs that are of their era, their time that you possibly would know that they like, turn them on for them. You may not see on the outside what it's doing, but they'll feel it on the inside. The last stage we're going to talk about is the pearl stage. So what's interesting about this stage is if you think of pearls are made up of layers, right? They're found in an oyster. An oyster on the outside is really not a really nice looking shell, right? It's an oyster. It's an ugly shell. But once you pry it open and peel it open, you have a pearl. You have a beautiful pearl. So these types of residents, they hardly move. These residents, they're now less mobile. They're more dependent on ADLs. They have the ability to possibly hit and spit. As we know, we see these behavior changes. That's a defense mechanism because they're scared. They're not trying to give you a hard time. They're having a hard time. They're frightened. So, they're trapped within the shell of their own body. So this type of person, they have one direction and one direction only, and that's forward. They don't know how to go back. So, they become a shell, so to speak. A shell that lays in bed, doesn't really engage, isn't very mobile, things like that. It's our duty as a healthcare worker to take care of that, not just the outer shell, but the inner shell. How do you do that when these people can't communicate? They really don't engage in conversation. We don't know if they understand us. We do that through our approach, music, our tone of voice, simple sitting at the bedside, making eye-to-eye contact, holding their hand. I understand during times of coronavirus, we may not be able to have that skin-to-skin contact, because of the fear of the transmission. We have to follow guidelines. However, just sitting beside them gives them a sense of your presence, a sense of human connection, and a feeling of warmth and a feeling of comfort. I want you to think about your tone of voice when you're taking care of this type of a resident. Okay, they want warmth feeling. Again, we don't know how they're feeling because they can't voice that. We know through behavior changes if they are distressed, right? If they aren't having behavior changes, then we can be more apt to think that they're comfortable. So the goal is to keep them comfortable. So through your voice, your rhythm, your approach during caregiving, be mindful of that. Sometimes voice either is inviting or not so inviting, right? So just somebody's tone of voice can really affect how the resident may be during care. So something to keep in mind about your dementia residents, they don't need to be imprisoned any more than they already are. And dementia does not stop for COVID, as we know. So the takeaway here, really with all the residents, is thrive with 5. So take 5 additional minutes of your time. I, for one, as a healthcare worker, know the struggles. I know the limitations, the resources that are dealt with when it comes to direct hands-on care, the limited resources that you work with on a daily basis. So I do understand that. But I am still going to say this is where you as a healthcare worker need to take 5 additional minutes of your time. I don't say this is just a healthcare direct worker. This is all disciplines. This is every department, activity, social worker, dietary. So this is something that the approach is really facility-wide. Thrive with 5 is going to be the theme for what the resident needs. 5 more minutes of your time. We know this may be difficult, again, with those limited resources, but every resident, studies show they can thrive with 5 additional minutes of your time. Communicating, interacting can force hormonal changes within their brain. Those hormonal changes are going to boost their immune system. This will allow for brain activity and for thriving. So again, not while you're engaged in doing a bath with them or feeding them, 5 additional minutes where you're putting the caregiving to the side and you're sitting there just interacting on a person-to-person basis. So an example would be sing them a song, one that they may know. Ask them who sings it. This is if they're able to communicate with you. This will promote brainstorming. It'll promote reminiscing, something our dementia residents do. It's a form of therapy, is reminiscing therapy. Ask them about their childhood, what they did, what their holidays were like growing up, what they did as a child, where they went to school, what type of job did they hold, did they ever have children? I mean, these are just all individual questions that you can ask about their past life. Music, again, as I said earlier, music will increase activity, bring them mentally to a time where they can't physically go, but to a mental time that they're very familiar with, an era that they recognize. So again, music allows for them to be alive inside. Remember, there's a person under that shell. They need the physical and the cognitive activity. They need verbal stimulation. They need 5 more minutes of your time, guys, 5 more minutes. Again, not bathing or feeding, but sitting and interacting. This is how we care for residents during a time of social isolation. One-on-one interaction. Recognize that some residents aren't safe to be left alone, so we do need to, keep engagement and observation there. So modifying your approach during the pandemic, and this could apply again to all residents, but when we think of the dementia resident that is not as receptive as a resident who's alert and oriented, how do you do that with them? So we still have to pause and keep that 6 feet of space there. But our dementia residents need daily routine for them. So trying to keep that 6 feet apart, within the parameters. It's going to reduce possible transmission while we're still trying to promote the resident to thrive. Help to fill their day with meaning, greet them by their name, whether they can respond or not. You greet them by their name, approach them slowly, make those good eye contacts, sit at their level. This will show respect, shows individuality, and will give them a sense of self-purpose. Give time to allow for the resident to acknowledge your presence or something that you communicate with them about. This will promote self-participation in their own caregiving. All of this together, guys, promotes a sense of balance, feeling valued, having fun in the workplace, and it promotes the whole caregiving process and makes a positive experience for everybody involved. So the takeaway is to remember to be aware there's different characteristics to this state, to the GEMS model approach during these stages of dementia. And you, as a healthcare worker, you have to learn to recognize these characteristics and stages so you can conform your unique individual approach and make it individualized to that patient at that time, to their needs. So the takeaway, thrive with 5 to keep our residents alive. So this last slide is our reference page. And as you can see here, I have some links. Teepa Snow, just to point out, she is a national dementia educator and specialist, and she is the one who developed this GEMS model approach. She has all kinds of videos, DVDs, things out there. If you want to Google her name, you will find everything and anything about her. But the other link on here will take you to the one slide that I had that you may not have been able to see. And that has all the stages, the characteristics, and the interests and likes, and gives you ideas on how to interact with them if they're in that certain stage. So I hope this helps. And thank you for being here. And I will give you back to our moderator, Jenna.
Thanks so much, Chris, for your guidance on how to communicate with residents during this time of crisis and the helpful tips like Thrive with 5 and the GEMS approach when caring for residents with dementia. I know that we are running over a bit here. We're going to move forward quickly. And so I'd like to turn it over to Linnell, who is going to walk us through the question and answer session. So please, if you have a question, use the Q&A feature at the bottom of the screen if you haven't already. Over to you, Linnell.
Thanks, Jenna, and thank you, Chris, for a great presentation. I just want to reiterate that all of the information that was shared in today's presentation will be emailed to all of the attendees, and it can also be found on our website at thetrainingfund.org. Chris, our question is, will there be or is there more information available on the GEMS model approach?
There's tons of information out there if somebody has further interest on it. Like I said, Teepa Snow is a national dementia educator specialist. She travels and she makes that her mission to advocate for the dementia resident. And I think her GEM model approach really breaks it down. It really just shows that under that shell, you know, as the resident changes, when we see the physical changes with the residents, we could then end up treating that resident different because, you know, on the surface, they appear very childlike. But her approach is really to stay focused on not what they lost, what they still have. So if you have further, you know, interest in it, please, you know, click on those links that will get sent to you afterwards. Like I said, she has books, she has DVDs. There's a wealth of information out there if you're willing to put a little bit of time into reading for it.
Okay, thank you so much, Chris. Okay, Jenna, we're going to turn it back over to you. We don't have any more questions today.
Thank you. So we have a next poll question, and this is really for us to gauge your interests, again, moving forward. So what topics would you like to learn about for future webinars? And if you don't see your topic listed here, please use the chat function to put it in there for us to consider. This is only going to allow you to choose one choice at this time. We'll give you about 10-15 more seconds. Viral shedding, simple activities for residents during social isolation, food handling and food safety tips, teamwork, caring for residents with dementia if you want to dig a little bit deeper, and COVID-19, living in red, yellow, and green. What does that mean? So about 5 more seconds. Okay. So thank you so much for your votes on this. Very relevant to our world today. What does it mean to live in red, yellow, and green? And we will take your considerations when planning for future webinars. So please check back often for our on our website for the next webinars. Right now, I would like to turn it over to Melania. We reached out to everyone for the Training and Education Fund benefits and asked for your feedback of what you would like to hear from us. And anything regarding stress relief was a resounding theme. So every Tuesdays with Tef, we'll have a short, easy meditating, yoga, deep breathing exercise that you can incorporate into your stress relieving routine. So Melania, please carry us through that deep breathing exercise. And I'm going to stop sharing so we can see you.
Thank you. Thank you very much for being here. And we're going to spend 5 minutes relaxing together. And I'm going to teach you a breathing technique called 4-7-8. And well, we all know we are going through really challenging times, and stress is everywhere. It is at work, it's in the news, it's at home, right? So it is really important that you as caregivers take care of yourselves first. And I don't know if you've noticed, but when we are stressed or we are experiencing anxiety, our breathing tends to change. So maybe we're gonna have like more shallow breathing, we're gonna have faster breathing, more superficial, and this affects our brains and our bodies. So it is important that we be aware of the way we are breathing in, and this will have a positive impact in our mental health. So for this exercise, we're gonna try to have deeper and longer breathings. So one way to know that your breathings are being deep enough is by placing one of your hands in your belly. And when the air reaches the lungs, this whole area is gonna expand. So what we're gonna try to do when we inhale is to feel our hand moving a little bit as these muscles expand, okay? So please get comfortable. Get in a comfortable position. Try to focus in your breathing only. If you have other thoughts, gently put them aside and go back to them later. So try to focus on the way you are breathing, okay? So we're gonna do the 4-7-8. This exercise is called 4-7-8 because we're gonna inhale through our noses for 4 seconds. We're gonna retain the air in our lungs for 7 seconds, and we're gonna exhale during 8 seconds. You don't have to count them. I will guide you through the process. If at any time you feel uncomfortable or dizzy or anything, you can stop and try it again later. Okay, so please join me. Let's start. Inhale for 4 seconds. Retain for 7 seconds. Exhale for 8 seconds. Very good. We're gonna do this 4 more times, okay? So let's inhale for 4 seconds. Retain for 7 seconds. Exhale for 8 seconds. Very good. Let's try it again. Inhale for 4 seconds. Retain for 7 seconds. Exhale for 8 seconds. Very good. Again, inhale for 4 seconds. Retain for 7 seconds. Exhale for 8 seconds. Very good. Let's try it one last time. Inhale for 4 seconds. Retain for 7 seconds. Exhale for 8 seconds. Very good. So as you can see, this is a really easy exercise. You don't need any materials. You can do it anywhere. You can do it while waiting for a doctor's appointment. You can do it at home. You can do it at work if you need 5 minutes for yourself. And as I was telling you, it is really important that we get into a self-care routine, especially you as caregivers. We need you, and the work that you do is so important. So the first person you need to take care of is yourself, and then you can take good care of others. So thank you so much for participating and for your time, and back to you, Jenna.
Thanks, Mayla. I'm going to quickly share my screen again here to get us through the last couple slides. We have one more really quick poll, and simply, would you take another Tuesdays with TEF webinar with us? If we can launch that poll very quickly. And any recommendations that you guys can provide in the chat feature, we'll take all of that information into consideration to plan for the future. This is our first Tuesdays with TEF, and back in May 19th, we had a stress reducing and management webinar, and so we'd love for you to please give us some feedback on this. So about 3 more seconds, and so thank you so much for being here today. All right, so looks like most of you would join again. We would love to see you back, and our very informative webinar today. Thank you so much, Chris. And thank you all so much for tuning in to this Tuesdays with TEF. We're going to turn attendee mics on in just a moment, but first I want to go through a few quick reminders to please check your email, because the recording of today's webinar will be emailed to all attendees, including the slides. And please contact us if you have any questions or other ideas for other webinars, or any other ways that you feel that the Training and Education Fund can meet your needs. For those of you that have the SEIU Healthcare PA health benefits and opt into them during open enrollment, the health plan has reduced mental health copays to $0 during this crisis. A letter with that information should have been mailed to you, but you can also call the number on the back of your card and be connected with someone for those benefits. We hope that you enjoyed today's webinar. We really hope to see you again at our next session on June 16th, when we talk about activities for residents during social isolation, where we'll focus on activities that you can do with your residents, even during quarantine, to help them keep physically and mentally active. And if you would like to stay on to ask other questions or just say hello, we're going to stick around for a little bit. If you need to sign off, again, thank you so much for attending. You are so important to your family, your residents, and to us. On behalf of the Training and Education Fund, I would like to express our appreciation for all you do, and even more so during this challenging time.